So that is the end of all the planned presentations and sessions. So I just wanted to take a moment to ask the group if there's any thoughts or comments or questions that maybe you didn't get to ask or you thought of since the presentation in the session, to kind of open the floor for any questions or comments or thoughts you might have on any of the sessions. It's a pretty quiet crowd today.
Okay, so I thought this was wonderful. I am curious if you're able to provide just a very high-level update on maybe what's going on with some of the other case quality work streams. Like, I don't know if they're still going on or if they've been resolved, like quality as a career, for example.
Yeah, well, we can take that as an example. Quality as a career work stream is still doing work and progressing, and so is C-suite leadership. That work stream is ongoing. I think we had a discussion. The steering committee, CFQ, MDIC steering committee had a discussion on topics that they wanted to present at this forum, and I think that those other work streams that the team felt was covered well enough in the last forum, so we thought we'd give a chance for some new work streams and topics and updates. So it doesn't mean that they're not still going on. Yeah. Yep. Any other thoughts or questions? Comments? No? Be quiet. All right. So I'll pose one to the group. So we did talk a lot about the VIP program. Oh, we have one. Thank you.
Sure. So can you hear me? Mine is secondhand. It was something that Rob leaned over and said to me just during the Make Kappa Cool presentation. He said, that's another offput from the original VIP, from the CMMI, the original appraisal. So that whole initiative was an output of what we learned during the appraisal process, and that was sort of reflect how there is value in the VIP program, but also how the FDA and industry responds to the output of the appraisal program. So I just had forgotten that. It's been long enough to forget.
That's good. That's very good to know. I actually didn't know that. I'm new, so that was good to know. So I think that's a good segue to something I'd like to pose to the group. Hopefully we can get some comments. So we talked a lot about the VIP program and the benefit that it has provided and is currently provided, the transition from pilot to program. Panel talked a little bit about what they thought. They saw the future of that program and what they'd like to get from it. But I thought it'd be nice to poll the group here and online what maybe you'd like to see from the program as it goes forward. Anything different or anything additive. So I'd like to open up that. Steve would have an opinion.
This might be really pie in the sky, but it'd be nice to see consideration of combination products and working with Peter.
All right. Nice. Thank you. Anybody else? Well, I'd like to thank everyone who was able to make it both online and in person with everything that's going on, the pandemic. I know that's a lot, and your most precious resource is time, so I really appreciate the time that everyone's taken to attend. That's very helpful. Thank you. So I'm going to move the slides over and let Cisco do his last presentation.